I'm Dr. Rita McGuire. I'm Chief Medical Officer here at Wakanna. I'm also one of the co-founders. I want to welcome you to our Wednesday webinar. Our Wednesday webinar is really a great time where we talk about our products. We talk about different health concerns that many of you may be facing, or maybe your family, your friends. But tonight I'm going to really more talk about products, not a particular health concern. At the end, you absolutely can ask questions. Tonight, we're going to talk about the health benefits of Delta 8, and we're also going to really understand, what sort of persons you would recommend Delta 8 to. Okay, so the whole goal is to look at Delta 8, look at our products, and then look at our other CBD products, because we know that there are guests on the line. So welcome all, welcome guests, welcome business partners, and we will get started. Well, every Wednesday, I promised you guys that we would highlight an African-American physician that is in medicine for Black History Month. And tonight we are going to recognize Dr. Nzike, who is the Director of Public Health for the Illinois Department of Public Health. She works very closely. If you live in Illinois, you may see her every single day. She works very closely with the Governor of Illinois, Pritzker, and her whole role has been the coronavirus. She keeps us up to date. She keeps us informed. She really gets us engaged with understanding the virus. She really helps us understand how the numbers fluctuate, and actually she helps us understand how the vaccine works. So Dr. Nzike Ganzi, she is the physician of the Black History Month Spotlight tonight. She is a board certified pediatrician, and she is really, truly a powerhouse in medicine and leading the charge. So let's talk about Delta 8. And we're going to talk about how it's different from CBD and how it's different from Delta 9 THC. So Delta 8 is a variation of the familiar THC compound. It's one of the 4 common cannabinoids that helps treat symptoms. But what I love about Delta 8, and you should understand, that it has less psychoactive effects. We know that Delta 9 tetrahydrocannabinol is the compound that the cannabis plant makes that makes us high, that gives us the euphoria and the paranoia. But Delta 8 actually addresses symptoms that you want to hear about this evening with a less psychoactive effect. It occurs naturally in the cannabis strains in trace amounts, and really with the help of modern science, Delta 8 can be refined from Delta 9 to create lots of new cannabis products. Delta 8 is the new kid on the block. More and more people are requesting Delta 8 in gummies or vape forms or concentrates, etc. So when we look at Delta 8, it's almost like it's a sister of Delta 9. Delta 9 is the most common cannabinoid found in the cannabis plant, next to CBD. And again, Delta 9 THC is known for its psychoactive effects. It's known for getting you high. It's known for the euphoria or sometimes the paranoia that it causes. But Delta 8 is a bit different. Delta 8, and why people love Delta 8, it tends to have a more calming and relaxing quality compared to Delta 9. So Delta 9 is really stimulating those receptors in the brain that gives you the euphoria. But Delta 8, we're going to find out, stimulates more of a physical, not a mental, but more of a physical calming and relaxation. So let's look at more of the benefits of Delta 8. So the benefits of Delta 8 vary by individual, but again, it's known because it has a reduced psychoactive qualities compared to Delta 9. You know, many people do not want to be high. They want to be able to work. They want to be able to take care of their children. They want to be able to do other activities without feeling high. So combining both Delta 8 and live cannabis terpenes, we talk about terpenes. Terpenes are a part of the plant that gives it its aroma. It helps to limit those psychoactive or psychotropic effects and give you more of a relaxed experience. So again, you're going to hear that Delta 8 is more calming, it's more relaxing without the psychoactivity that Delta 9 gives you. Additionally, Delta 8 connects to these receptors. You know, we talk about receptors in our body that's looking for cannabis. You know, these receptors are found in the brain, in the central nervous system. In fact, these receptors are found throughout our entire body. And what we find is that Delta 8 connects to more of these receptors, so it's able to produce a more full body effect and less of a mental effect. Delta 8 is not as dominant, of course, as Delta 9, because Delta 9 is the #1 dominant cannabinoid found in cannabis, but it can produce a calmer experience. So there's very little anatomical difference between Delta 8 and Delta 9, and that's why it gives that calming and relaxation effect, but not nearly as heavy or pronounced as Delta 9. Well, let's look at the cannabis plant because many of you may be on the line and this is all new to you. So the cannabis plant has over 100 plus cannabinoids or compounds. And again, the two most common compounds found in the cannabis plant is THC or Delta 9 tetrahydrocannabinol. That's the one we continue to talk about that makes you high and makes you euphoria and gives you paranoia. And then there's CBD or cannabidiol, because we're going to talk about cannabidiol and CBD because we are a CBD company. But the difference that we find is that though CBD and THC can come from the cannabis plant, it's really the CBD that we talk about coming from the hemp species, coming from the part of the plant that gives you the health without the high that folks are looking for. Folks are looking for an alternative to their health. They're looking for an alternative to their anxiety. I mean, how many of us are anxious right now? You know, just the anxiety of the global pandemic. Now we have the anxiety of, should we get the vaccine or shouldn't we get the vaccine? You know, there's a lot of anxiety going on. There's a lot of interesting climate changes that are going on. I heard that you folks in Texas have had a storm, a winter storm, an ice storm, where thousands and thousands of people are without power, more anxiety. So it's the CBD that comes from the hemp species, which is defined as containing less than 0.3% of THC. It gives you the health without the high. Whereas the marijuana species, many of you have heard about marijuana before maybe, it contains high levels of that THC, so it gives you that high, it gives you that euphoria, and many people are looking not for that. They're looking for anxiety to be reduced, depression to be reduced, be able to sleep without being high. So when we look at the difference between CBD and Delta 8, we've talked about the difference between Delta 8 and Delta 9, and hopefully you understand the difference. I'll mention it again. Delta 9 is the part of the plant, the cannabinoid, that has the psychoactivity that gives you the high. Whereas Delta 8 is another cannabinoid from the cannabis plant that has very minimal psychoactivity, but it gives you more of a physical calmness and relaxation. So Delta 8 truly, truly is starting to pique interest. I think that in the coming months, you're going to have a lot of your old customers coming back to you and asking if you have Delta 8 products, because it's becoming the new kid on the block. It again is able to function like CBD, but with much more noticeable effects. So right out of the gate, you should understand that Delta 8 is like CBD, but on steroids. So it gives you a more noticeable effect than CBD. So CBD, Delta 8, they're both less psychoactive than THC, Delta 9. It doesn't give you the high. It's more physically sedative rather than mentally sedative. When we consume, patients will not experience, when they consume Delta 8, they will not experience that psychoactive effect that is common with cannabis or Delta 9 THC. So there's no social anxiety, there's no couch lock, and there's no paranoia. CBD and THC bind to two different receptors. As we talked about, Delta 8 binds really heavily to both CB1 and CB2 receptors. Again, these are the receptors that are in our body, which is called the endocannabinoid system, that all of these cannabinoids bind to, and that's how they work. That's how they work to bring us balance. That's how they work to give us, again, better sleep. That's how they work to make us relax and be more calm. That's how they work to reduce depression. That's how they work to help to reduce inflammation. So with the act of binding to both of these receptors, Delta 8 again creates a more comfortable and social effect, a more calming and relaxed effect. So let's look at some of our Delta 8 products here at Wakanna. See, Wakanna is a CBD company, and we understand that these new cannabinoids, one being Delta 8, is really what the millennials are looking for. Millennials are looking for that product that kind of gives them a semblance of the way THC Delta 9 would give them. And so that's why we here at Wakanna are very excited about this new product, because this absolutely is a product for the millennials. That part of the world that we call the stress and anxiety sort of folks out there, right? Our millennials, our Gen Zs, they're under a lot more stress than our baby boomers. So it's a great product for them. All of our products here at Wakanna are tested, and that's what I love. Also, you'll find all of our testing on our website. We have certificates of analysis, which is critical. Certificates of analysis are critical in the CBD industry. Why? Because there's a lot of products out there that are marketed as CBD or marketed as Delta 8 THC, but they have very little CBD or Delta 8 in them. And so by the testing, not only do you see the potency that's in the product, but you actually see the fact that there's no harmful products like toxins and heavy metals and mold and mildew. See, all of those products can be included if that hemp that we talked about is not grown organically. So if the source of the hemp in the soil is now accumulating those heavy metals and toxins and harmful things that when you consume can be very dangerous. You know, especially when you're talking about helping a loved one that may be immunocompromised, someone that may have cancer, and you're really trying to help them with their nausea and vomiting. or someone who may have an autoimmune disease like lupus or fibromyalgia or multiple sclerosis or rheumatoid arthritis, or HIV. All of those conditions, the immune system is compromised, and you absolutely could harm that person if there's toxins and heavy metals in products. So our products are tested. Our products contain certificates of analysis. Every single product does. So let's talk about our Flight 50, our Delta 8 gummies. How many of you tried our gummies? If you're on the line and you've tried the gummies, I want you to put in the chat box that you've tried them and how you're liking them. And some of the features and benefits of Delta 8 gummies may help or may assist, because we can't make any claims. We can't make claims of curing or mitigating any condition, but what we can say is that it may help. It may help to assist with the following. It may help with creativity. It may help to enhance sex and better sleep. It may assist to give more energy, slightly energizing for some. And all of our products within our gummies and all of our products are organic ingredients. So our Flight 50 Delta 8 gummies comes in a, I'm going to show you the label here so we can really get into this. It comes in a 15 count bottle or a 4 count package. So the 15 count is 750 milligrams in total. That's 50 milligrams per gummy. And this is why it's so important that you really start low and slow, right? Delta 8, we talked about. Delta 8 has more of a psychoactive effect, not as pronounced as Delta 9, but a more calming and relaxing. So you don't want to eat right out of the gate the entire gummy. We recommend that you start with 1/4 of a gummy. You wait at least 90 minutes before you increase the dose. Why 90 minutes, Dr. Rita? Well, gummies, when they're consumed, has to go through your intestinal tract, right? It's got to go through the stomach. It's got to be metabolized to the liver before it gets into the bloodstream. So in most people, that takes between 60 and 90 minutes. So you don't want to find yourself saying, I'm not feeling anything, and you're eating and eating and eating more and more gummies. Well, that's not going to be a good thing. So start low, start slow with 1/4 of a gummy, and then increase after 90 minutes. Some of the organic ingredients that we find in our gummies is the organic tapioca syrup, organic cane sugar, fruit pectin. And you may wonder, I'm a diabetic, can I take this? It's about 2 milligrams of sugar in each gummy. So that's not a lot, especially when you're eating 1/4 of a gummy, okay? So this is a great product for sleep, assisting with sex, assisting with creativity, assisting with anxiety to help you feel calm and relaxed. Again, you want to be careful and take this product when you're at home. You don't want to take this product and then decide you're going to go drive somewhere and get some groceries or something, right? You want to, because it's Delta 8 and it has more of a pronounced effect than CBD, you want to make sure that you're at home and not performing any machinery or driving, okay? So that's really, really important. Start low, start slow, wait 90 minutes before you increase. Now the 4 count pack of gummies is 200 milligrams, 50 milligrams each. Again, the same directions. Start with 1/4 and wait at least 90 minutes. You don't want to start driving or operating any machinery. And of course, you have to be over the age of 21. But these are great, great products. Again, Delta 8. Think of Delta 8. Think of Delta 8 like this. Delta 8 has a more pronounced effect than CBD. It's like a CBD on a steroid. So it's less psychoactive than Delta 9. It doesn't give you the high, it doesn't give you the euphoria, doesn't give you the paranoia, but it absolutely does have a more pronounced effect physically than CBD. So again, this is a great product for maybe your customer or maybe even yourself that feels like, I just need a little bit more. You know, this CBD is addressing some of my issues, my challenges, but I just need a little bit more. Delta 8 is what you're looking for. That's that little bit more. Let's look at our tinctures. Let's look at our CBD tinctures, because many of you on the line may be new and you want to see our other products. Well, we have a product line of power. And again, the power products are the products in the black labels, and the pure or broad spectrum products are in the white labels. The white labels are products that you can take if you have random drug screens at your job. The Delta 8 products you don't want to use if you have random drug screens at your job. You want to use the pure products. Let's look at our Hempranium 500. That is our #1 star and seller. It is 500 milligrams of CBD in a 15 ml bottle. And a tincture means it's an oil. That means you place it underneath your tongue, you hold it for 60 seconds before you swallow so that the CBD can get into the bloodstream. And we always start low and slow, even with the tinctures. 3 drops in the morning, 3 drops in the evening is the way you want to start. Our Hempranium 500 is very unique. It's a very unique product because it is enhanced with essential oils like black seed, turmeric. Everyone knows turmeric, right? Turmeric is a great essential oil that helps to reduce inflammation. It helps to improve memory. When you combine that with the CBD and the other proprietary formula with black seed, which helps to reduce those beta cells in the pancreas to not be so inflamed so they can produce insulin for those diabetics. It is a game changer. So our Hempranium 500 milligrams is a great way to start and to add that Delta 8 to. Our Power 500 milligrams, that's the one in the middle here. It is a water soluble product. It's a great product that you can use just like the tincture, but you don't have to hold it under your tongue. You can actually put it in your water, your fruit juice, your oatmeal, any food or liquid, you can put the Power water soluble in. It's a great product. I love using this product in those who have dementia, that grandmother, that grandfather who is not able to hold the oil underneath their tongue. So you can easily put it in their food, easily put it in their whatever they're drinking, and they can get the benefits of CBD. What are the benefits of CBD? We didn't talk about the benefits of CBD. You know, CBD actually helps to reduce inflammation. CBD helps to reduce anxiety. CBD is a powerful antioxidant, so it helps to address those free radicals. See, free radicals come into our body and they cause a lot of damage. They damage healthy cells and they cause a lot of inflammation. They can cause cancer as well. CBD also is an anxiolytic, so it helps with anxiety. It helps with depression. It helps with those who have multiple sclerosis. It helps those who have digestive issues like GERD and reflux. And CBD does a lot, and it does it again through those receptors we talked about that are found throughout our entire body. Do your due diligence. If you're a guest on the line, do your due diligence, you know, do more research because the research is out there. There's over 20,000 peer-reviewed articles that you can find about CBD and its benefits, as well as Delta 8 THC and its benefits. Let's move on to our Power Hempranium product. It's another product that hemp-powered hair product, excuse me. No, it's Hempranium MD product. Our Hempranium MD product is our most potent tincture. It has between 750 and 800 milligrams of CBD in a 15 ml bottle. What I love about Hemp MD is that it's a great product to use for those who have really chronic long-term conditions. I mean, they've had 15, 20 years where someone may be struggling with challenges of osteoarthritis or struggling with symptoms due to gout or sciatica or neuropathy. So Hempranium MD is really something you want to use on those folks that have pretty serious challenges in their life, really causing their quality of life to be affected. Again, 3 drops under the tongue in the morning, 3 drops in the evening is a great way to start all of these products. Start low and slow. You may say, but Dr. Rita, this person is in a lot of pain. I want to give them 15 drops twice a day. And you know what I'm going to say? Please don't do that. Because not everybody needs that much CBD. You know, how do you figure out how much somebody needs? Well, it's really dependent on so many things: their weight, their diet, their body chemistry, how do they metabolize CBD, the severity of the condition. So that's why we like to say start low and slow and to increase as needed. So that's our Hemp MD. Our Hemp MD is a great tincture for those who really have serious challenges that is affecting their quality of life. We have another tincture here called our Empowered Hair. Our Empowered Hair, as it is termed, is for your hair. For those who have hair thinning, hair loss, or alopecia. You know, alopecia, hair loss, can be the #1 symptom that women present with in my office that have lupus. They can present with hair loss. And you may not, as a patient, think that you have lupus. You may think you have hair loss due to something else. But again, this is a great product that you can use as a tincture to help thicken the hair, to help those edges, to help that follicle to restore itself. This product can also be used topically. So if you have drug screens at your job, and this is a power product that contains the legal limit of THC, which is 0.3% or less, you're going to want to use this product topically in the areas where it's thinning, in the area where there are patches, okay? Let's turn to our broad spectrum product. The other 2 products here are smaller quantity in volume, but our broad spectrum product, our pure product, is 300 milligrams in a 15 ml bottle. And what I love about our broad spectrum product is that we have enhanced this CBD product with a special technology. It's called nanotechnology. And nanotechnology we use a lot in oncology and cancer therapy. And what nanotechnology does, it makes the molecules so small that it becomes more available to the cell. So this product is 98.7% available to the cell so that it can really be more effective for those who cannot have that THC. So the pure product, 3 drops in the morning, 3 drops in the evening. That pure product is for those who have random drug screens at their job. And then our Hempranium 500 and our pure product come in a 5 ml. It's a great way to start with our products by maybe sampling folks with a smaller quantity, and that's our 5 ml bottle. Let's look at our topicals. I love our topicals because I work out every day. Well, because of this new work schedule I have, I've not been able to work out every day, but when I work out, these products I use the topical products to offer local relief to that right knee, that left shoulder, my lower back. Many of you, if you are on this call every Wednesday, know that I was suffering from a heel spur, which is absolutely gone. It's resolved. with using these products, using my orthotic, using my stretches, absolutely not bothered with the heel spur. So I'm so grateful that these products are available. I'm grateful that I didn't have to go and get steroid shots in my heel. Oh, sounds painful. So our topical products are our 200 milligram and our 400 milligram. They're the exact same product, but different quantities. And our 500 milligram. Then we have something called a Dr. Rita's Rub on the far right, which is a liquid topical product. What's the difference? Well, the way I use the topical products is what I've been really recommending to people a lot more that have pretty moderate to severe challenges due to symptoms from arthritis or neuropathy or sciatica. And what I recommend is using the Power Relief Extreme at night. You know, putting that cream on those areas at night when you're sleeping. Now, the Dr. Rita's Rub, which is in the liquid form, I actually use during the day, throughout the day, and before I work out. Now the 500 milligrams, and if you're on the webinar, I want you to put in the chat if you love the 500 milligram. I love the 500 milligram because it has more of a menthol cooling effect. So I like using the 500 milligram post-workout. So you can see I have a regimen, and you have to find your sweet spot. You have to find which products work best at different times of the day. But my sweet spot is using the Power Extreme Relief at night when I'm sleeping. I hit those areas that cause me to wake up in the middle of the night with pain. I use the Dr. Rita's Rub during the day or pre-workout, and I use the 500 milligrams post-workout. So that's how I use these products. You can use these products on your heels, if you have plantar fasciitis, on the soles, on your hands, on your elbows, on your shoulders, on your back. My daughter uses this product topically for her menstrual cramps on her abdomen. So just amazing products. Again, our products are unique. We have a proprietary formula where we've enhanced these CBD products that are topical with essential oils. See, essential oils are also very key in reducing inflammation. Essential oils are key in reducing pain. And so that's why these formulas work so well. We just don't have a bottle of CBD for you. We have a very unique proprietary formula that really enhances those who are looking for relief from pain and in a topical way. Now, because they're topical products, they don't pass the blood-brain barrier, which means that you can use these topical products if you are undergoing random drug screens. They won't pass in the urine and very safe. We have our Power Body Mango Cream. What I love about this Power Body Mango Cream, I've learned from Dr. Lorraine Sylvester, hope you're on the line, is that she's got a client or two that actually have found relief from this body cream with assisting with their pain. Yeah, the Power Body Mango Cream. And it makes sense theoretically, right? Because it's 400 to 500 milligrams of CBD. So the body cream is to also address the skin. See, the skin is the largest organ in our body. So we've got to maintain good skin, guys. You know, we have to maintain good skin, its luster, the collagen. Us women, we don't like wrinkles. It can help to assist with those who have eczema, psoriasis, and acne. That is the Power Body Mango Cream. Again, CBD reduces inflammation. CBD is an antibacterial. So when we look at all of the medicinal benefits and we look at conditions that have inflammation or a bacterial origin, we want to share this product with those. Our empowered hair is under topical. Why? Because you can use the empowered hair as a tincture underneath your tongue, or we talked about using it in areas where the hair is thinning. You know, men use empowered hair. Yeah, they use it on their beard. My daughter used empowered hair on her eyebrows. You know, these young Gen Zs and millennials, they want those thick eyebrows. So wherever you are looking to have thicker skin, a thicker hair, not thicker skin, a thicker hair, this is a great product as well. Our Oud body oil is, again, our Glow Naked. It's not a CBD product, but it has what we call our Oud oil. It helps to refresh, restore the skin. It is also an aphrodisiac. You have to do your research on Oud. It's a great product to use in the bedroom, as well as soon as you get out of the shower, you want to use that Oud body oil. Those are our topicals. Let's move on to our smokables. Our smokables I love because smokables are able to give you an effect within 1 to 5 minutes. So when you're looking for an acute result or an effect from CBD, may it be from anxiety or pain, or you're nervous because you had to speak on the Zoom webinar, the smokables is what you want to look for. Also, I've got about 5 patients who have reduced their nicotine intake from our CBD joint. CBD is known to block the reward center in those who have cravings like nicotine and other cravings. It blocks the reward center so that those who have that constant recurrent addiction to nicotine, CBD can come in and block it. And instead of smoking a cigarette, they would pick up that CBD joint or our cartridge. 1 to 3 pulls on that will help relieve that desire. So our cartridges are hypnotic cartridge and our raspberry jane. The difference is the raspberry jane has more of a raspberry flavor. Our hypnotic, I love because I love peppermint. It has more of a peppermint infused taste. Both are great. Again, more is not better. 1 to 3 pulls on the cartridge or the pre-roll is all you need 3 times a day. So if you're looking for someone that you love to stop smoking, you want to get that pre-roll in their hands or the cartridge. But the pre-roll feels more like a cigarette, so you want to use that pre-roll and let them know. Tell your friend, whenever you have the urge to smoke a cigarette, pick up the pre-roll instead. And you'll notice that they're going to come back to you in about a month or maybe sooner and say, you know what? I've reduced my nicotine intake. Our premium flower is another great product for those who like to either roll their own CBD joint or they like to vape the flower. We know that vaping is a lot more beneficial for those who may have lung issues, right? It's always those who have asthma that love to smoke. I never understood that as a medical student. I'd be like, I wouldn't say it to the patient, but I was like, don't you have asthma? Why are you smoking? But I don't know why, but many patients with asthma love to smoke cigarettes. So this is a great product, again, for those who may have some lung issues, but smoke. You would love to get that in their hand, the premium flower. They can buy a vape pen and they can vape the flower as well, or they can roll the flower. So those are our smokables. Smokables are great to use throughout the day, along with the tinctures, along with the topicals, and hit it with a 1/4 of a Delta 8 gummy, and you should be all good. But wait, there's spices. I can't forget about our spices and our butter. Our spices are amazing because our spices, like our other gummies, are not coated. They're infused. So the CBD is within the spices, our chili lime, our garlic fire, our flavor king. They're great ways to enhance your food and get the benefits of CBD at the same time. Our butter is vegan, it's non-GMO. Funny story, again, my daughter thought it was body butter. I don't know who puts body butter in the refrigerator, but she put my butter on her body. But this butter is amazing. It's a great butter to put on your toast, in your oatmeal, full of 300 milligrams of CBD. Again, non-GMO, vegan butter. It's a great way to enhance your food and get the same medicinal benefits of CBD. Now, I forgot to add our other gummies. We have gummies that are our power gummies that are 0.3% or less of THC. And we have gummies for those who have random drug screens. I did forget to add that slide. I apologize, but we absolutely have something for everyone here at Wakanna. Our essential oils. We have some new essential oils along with our black seed, our eucalyptus, our peppermint and tea tree. We have essential oils for those who have to graduate up to CBD, right? Even though we explain that CBD is not marijuana, it doesn't come from the marijuana species. Our CBD is coming from the hemp species. It doesn't make you high. It's the health without the high. Some people are still resistant. So this is a great way to kind of start that customer out with baby steps. We've got essential oils that you can offer them for their wellness. You know, black seed is something that you want to recommend to that customer that has some issues with glucose control. It helps to rebuild the beta cells of the pancreas. The pancreas beta cells are what produces insulin. And if you don't have enough insulin, your sugar is really high, right? And that's what we see in those who suffer from diabetes. So black seed is something you want to add in addition to the tinctures, in addition to the topicals, in addition to the smokables, in addition to the gummies, because it's going to give, again, that additional benefit in reducing inflammation, being a great antioxidant, helping with blood sugar levels, helping with cholesterol, digestion, the liver. What doesn't black seed do? I mean, black seed should be in everyone's home that wants to really bring more wellness in an organic and natural way. Eucalyptus is another essential oil that's really important during this time. It helps with the lungs. You can put it in a diffuser. You can put it in the palms of your hands and have an automatic diffuser with the palms of your hand. Peppermint. I love peppermint. I put peppermint on the soles of my feet in the morning because the pores in the soles of your feet are the largest pores in your body. So peppermint gives me energy. So that's how I use peppermint. Tea tree oil is another great essential oils that's really great to reduce bacteria, to help reduce inflammation as well. So essential oils are really, really an important part of our Wakanna line. So that's all for me tonight. We're going to take questions. Hopefully you understand the benefits of Delta 8. Again, Delta 8 versus CBD. Delta 8 has more of a pronounced effect than CBD. So for all your customers, or maybe even you on the line, if you need that little bit more of a resolution to whatever you're challenged with, you want to get the Delta 8 gummies to help push you past that line where you're getting resolution. So it's like a CBD on steroids, but it doesn't get you the high like Delta 9 THC. It gives more of a physical, more calming effect, more relaxing effect, more creativity. It's really helping with those same benefits of CBD, but with a little bit more noticeable effect. There is my email. So if you have any additional questions after we take questions tonight, It's ritamd@wakanna.com. You can always email me. You can always ask me questions. You can always give some suggestions on some topics you want to hear. But I think it's really important that you understand Delta 8. Hopefully you understand Delta 8 a little bit more than you did before you got on the line. So I'm going to stop sharing and stop talking and take some questions. And we have some of our Wakanna Medical Advisory Board on the panel. So thank you, Robin, Tillman, and Dr. Betty. Thank you so much for joining us. And I'm going to see if anyone else is on the line on the other side that we can promote as a panelist. There's any other advisory board members who forgot to get on the line? Yes, I do see you out there. Let's move them over first, and then I'll take some questions. There's Dr. Sylvester, there's Erica Zachary, there's Dr. Rashonda Conti. I love our Wakanna Medical Advisory Board. I'm telling you, they are awesome. See if there's anyone else out there on our board. And another thing, if you have anyone, if you're one of our business partners, or maybe you're our guest and you are really interested in locking arms with us here at Wakanna, we are looking for healthcare professionals to join our board. We are growing each and every month. So please reach out and let me know who that is. You can email me if you're interested in joining our board. Okay, first question from Edward. What product is good for high blood pressure other than getting stuck on a lifetime of blood pressure meds? So, you know, when you look at the data and the research with CBD, the data has shown that CBD is a vasorelaxant, and that's why CBD has been very helpful in those who have blood flow issues either being hypertension, blood flow issues being erectile dysfunction. A vasorelaxant means that CBD comes into the blood vessel and actually helps to open and dilate. CBD also is an anti-inflammatory. So when we talk about high blood pressure, diabetes, obesity, heart disease, there's a lot of inflammation that's occurring in the blood vessel. So it reduces inflammation. So that's how CBD can assist with high blood pressure, because of its ability to be a vasorelaxant, its ability to reduce inflammation, and its ability to be a great antioxidant as well. So the product that would be good for what you're looking for would be our Hempranium 500 milligram tincture. That's a tincture that you place underneath the tongue twice a day. Another great product to add on to that, obviously, are our gummies at night, so that it can address inflammation and help you sleep as well. And then you want to also look at our smokables. Our smokables are a great product to, you know, offer during those times of anxiety that always spike our blood pressure up. Would be a great product for those times. So the cartridge would be good. I always love adding their smokables to everyone's regimen for those acute times that you need to get CBD in the system quickly. The tincture, of course, and the gummies. The other thing that you absolutely don't want to forget, Edward, is your diet. You know, CBD is not magical, and someone who continues to eat processed food or fried food, or, you know, foods that are processed tend to have a lot of sodium. So you want to make sure that you're getting enough rest, you're drinking your water, you are following a diet that is free from processed foods and fried foods, so that the CBD can really be effective. Getting your exercise in, all of those lifestyle modifications that you should be doing when you have chronic conditions like high blood pressure. So tea tree oil directly on the skin, whenever you apply something directly on the skin, you want to do two things. One, you want to use a carrier oil many times. And Dr. Betty, you can chime in on this, because there's some people that are very, very sensitive. There's some people like myself, I've used tea tree directly on the skin around my toe because I had a little cellulitis going on. And then there's some people where it's very, very sensitive. So you always, whenever you use a topical product, you always want to test the area that you're putting it on. You never want to put anything on an open wound or an open cut. And you always want to consider diluting it with a carrier oil like MCT coconut oil. Dr. Betty, if you want to unmute yourself and you want to add anything else about using TT directly on the skin. If she doesn't unmute herself. Delta 8, yes. So Delta 8, helping with inflammation, because the cannabinoids all have some sort of anti-inflammatory properties. CBD has more than Delta 8. Delta 8 is that product that is more of a calming, relaxing, but it has anti-inflammatory, antioxidative properties. That's why I always stress, if you're that person where you're on the CBD, you just need a little bit more effect to the CBD, you want to add the Delta 8. So if you're looking, Dr. Roz, at someone who has inflammation or someone who's suffering from conditions that causes pain due to arthritis maybe, or sciatica or neuropathy, maybe you've got them on the Hempranium MD. Maybe they've exhausted that 15 drops twice a day. Maybe they've exhausted the limit of the dosing that's recommended. That's when you bring in that Delta 8. That Delta 8 is going to give a more pronounced effect of CBD. So it's like CBD on a little steroid. Not great. I don't want you to think that it's going to be overpowering, but absolutely, yes, it has some of those same properties. Great question. Yeah, glad the butter is back as well. Yeah, black seed, Diana, you want to use your black seed more often. I want to tell you a true story about my 25-year-old who had really bad allergies. He was that guy that goes out when there's pollen. He can tell you when the pollen is coming before the pollen is there. And I put him on black seed, Cranium 500, and I took dairy out of his diet. And I did that. My son has truly changed his life. He can actually go out and play golf when pollen is flying around. So black seed is something that you absolutely want to use more often, every day, and in your home. Dr. Betty, were you trying to say something? I saw that you were unmuted.
Yes, I am. Good evening, everybody. I just wanted to add a couple of things to Dr. Rita's extensive explanation. In terms of the tea tree oil,
yes,
it's very important that you do not get that oil or any other essential oil in your mucous membranes, like your eyes, even your nose, especially undiluted. Essential oils are very, very concentrated, and it only takes a very small amount. So you may want to try 1 drop of essential oil to 2 to 4 drops of your carrier oil, such as, it could be olive oil, it could be MCT coconut oil, it could be grapeseed oil. All of those are great. Yeah, I've got an experience with myself. I do body work, And so my thumb was extremely tender. In fact, just moving it and trying to pick up something gave me an, oh, that hurts. And it finally clicked in, get your extreme relief cream. And I put it on, and I'm telling you, within 5 minutes, the discomfort was gone, and I really have not felt it since. One more, one more. Now, Dr. Rita, one more. Dr. Rita mentioned using the mango body cream, body lotion for pain relief. I have a customer who has extremely painful knees, and she tried the extreme relief and wasn't satisfied. She tried the mango body lotion, and she swears by it. So there you go. Everybody's body is different, so try a number of the products. Don't just try one and say, ah, it doesn't work. Thanks.
I love that. I just love that. Everyone on the line, remember that. That mango body cream, power mango body cream. I'll get it together. Use that for customers who are not finding what they're looking for in relief as it relates to the other topical products. You're the second person. Dr. Sylvester has clients that swear by it. So use that. Now, what do I mean by creativity? What I mean by creativity, have you ever had those times where you're foggy, you're not clear, you're not focused, you're trying to complete a task, but you can't because your mind is everywhere? Well, Delta 8 helps you to be focused. It helps you to be creative. It helps you to be calm and sedate and more relaxed. So creativity means that you're able to think, you're able to focus, you're able to concentrate, you're able to finish whatever task you're trying to do because that Delta 8 has kicked in. So I hope that helps you. That's the creativity. You may be trying to think of a presentation and how to end it, but you just can't. That Delta 8 will give you that creativity and that focus and that what you need.
I like to call it mind expansion.
Mind expansion. I love that. I love that. Yes. Wonderful. Yeah, like musicians do by smoking a joint to be creative. Thank you, Dr. Ross. That's exactly it. So it's a
Dr. Betty.
Pardon me?
That was Dr. Betty.
No, Dr. Ross. Dr. Ross.
Oh, she mentioned about the musicians.
Yeah, right.
Okay.
Right. It's about 9 o'clock. And you know what happens at 9 o'clock? I have to go upstairs and deliver some babies, some COVID babies. We're really busy here. But if there's anyone else on the panel that wants to say anything, wants to add anything, Dr. Ross, yes, you have a question? You had a question before that. Dr. Ross, it's been a long day. So I'm going to promote you to panelist and you can ask your question because I don't want to miss it. You can unmute yourself.
Can you hear me?
Yes, I can hear you.
Okay, no, the question was about, I have a godmother, she's a diabetic. She's been taking our Hempranium and our gummies and our topical cream. Her A1C levels have decreased and her doctor has decreased her amount of insulin. So my question is, I want to get her to start doing the black seed, but I want to know, does she take the black seed at the same time she's doing the Hempranium, or is it a separate, totally different time that she should take the black seed on?
I take my Hempranium, then I put my black seed in. Same.
Okay.
Yes. I would start with 3 drops of the black seed. I love black seed. Love black seed. We got to talk more about black seed and use more black seed, guys, because it's really has really helped so many people that I love. Erica Zachary, how are you today?
Hi, Dr. Rita. Yeah, I was just going to add, so I'm kind of struggling a little bit today, but I'm so grateful that I have Wakanna products in my house. Oh Lord, I feel like I've been using them all day. It's about to snow here, and like your son could be the weatherman for his allergies,
Yeah.
I could be the weatherman for snow and rain and changes in humidity and all of that. But I was going to add two things. One is don't be afraid to mix them together. I woke up this morning not really sure what's going on with my feet. I have neuropathy, and I usually put the pain cream on when I have neuropathy, but today that wasn't quite working, and I used them, and I realized they were really dry. And I got to see my doctor next week because they also had like a purplish bluish tint. So I used the mango cream, the mango lotion, and the body cream, and mixed it with the pain relief and rubbed that on. And as I was rubbing, I could see some of my not only my feeling coming back, but the color coming back.
Wow.
So that was really helpful because it was scary looking at my feet. I'm like, why are they purple? So I guess something about circulation. I don't know what's happening there. The other thing I wanted to mention is, so I'll be glad when Delta 8 gets here. I ordered my gummies. I wish they were here today. It's just been a struggle of a day. And then so I'm glad you asked the question regarding creativity, and that means more focus. I was having difficulty focusing today, but I also wish it was here because I'm anticipating more difficulty sleeping tonight. So I take my gummies like I normally do. I just took my Hempranium MD a few minutes ago, and I'm sitting here trying to figure out this the vape for the flower. So that's why I'm sorry I missed the meeting earlier. I didn't really realize it was for the board members. But I am a product of the product for sure because they work. So I'm sitting here surrounded by lots of stuff. So I just wanted to share that in regards to the pain cream and the mango body cream.
Yeah, you trying to use that butter like my daughter, huh? No, I'm kidding.
I put that on my bagel today. I'm just trying to get it in, however I can get it in. So yeah.
I love it. Well, thank you for that. Thank you for that testimony. That's great. Dr. Raj just told me my slides weren't changing. Did you guys not see my slides? Were they stuck on products?
No, that was it earlier.
Oh, okay, good. Okay, thank you so much. Well, if you're a guest on the line, we want you to connect with the person that invited you, because I know you're excited now that you really understand how our products work and how amazing our products are. And there's something for everyone. So we want you to connect with the person that invited you so you can get those products ordered. Again, we'll see you next Wednesday evening. My email, ritamd@wakanna.com. You can always email me. You can touch base with me via my email. Thank you, Wakanna Medical Advisory Board. You guys are always amazing, always showing up and showing out and really adding so much value to these Wednesday night calls. And thank you, business partners, for being on the line. And thank you, guests. We are so excited to have all of the guests on the line. Have a good night. Be well and be safe.